U.S. lawmakers are working to cut programs to help reduce the debt. Jessica Torricelli tells us how any possible Medicaid cuts could impact a local health center.
We exist to serve the patient population, the medically underserved population, the lower income population. We also serve, we're the only provider in Northeast Louisiana that provides HIV care and support services.
And those patients are now at risk of losing that care.
We have great concerns that we may lose HIV prevention funding. When I talk about HIV prevention funding, that is funding that comes through the CDC where we can provide free, rapid HIV, syphilis, and hepatitis C tests. We gave those free tests to over 600 people in 2024.
They not only offered free testing with that funding, but also free preventative care with over 50 condom sites in Region 8.
If we lose that funding, what's going to happen? We're going to have a greater incidence of HIV and STIs. We're going to have a greater number of unplanned pregnancies. We're going to have people who are not going to get tested because they feel like they won't be able to afford to get tested, and we won't have that mechanism to provide the free testing for them.
Possible cuts to Medicaid are a concern for Pinnacle. Medicaid reimbursements allow them to take patients who otherwise couldn't afford care.
Our emergency rooms are going to be flooded with patients because that's the only place they feel like they can go. They're not going to seek care, and many of these people have chronic conditions that need to be managed regularly. So what's that going to result in? Early deaths, early hospitalizations.
Wyndham says about a third of Louisiana's population relies on Medicaid.
About 46% of our adult patient base are Medicaid recipients, and that could be devastating for community health centers, not just across Louisiana, but across the country.
They go a step further than just health care. They offer transportation to medical visits, help the unhoused population find stable conditions, and provide food assistance.
Let our federal legislators know how important these prevention funds are, what the impact they have on our region. You know, we're already in we're one of the hot spots in the country for STI rates. I worry what's going to happen if that funding were to go away.
And thanks to federal funding, Wyndham says over 90% of their HIV patients become virally suppressed, meaning they can't pass it to someone else sexually. Without that funding, the number may not be so high. Meantime, House Speaker Mike Johnson recently appeared on Face the Nation saying they are not cutting Medicaid.